Hey everyone, today I'm going to be talking to you all about the basics of sensory-based feeding and eating for kids. If your child is a picky eater or has aversions to a lot of different foods, this video will provide some insight and strategies on why that might be and what kinds of things you can do at home to improve your child's eating habits. So let's first talk about all the basic sensory components of food. When we are interacting with food, we are noticing a lot of different sensory components of that food. So one of the first things, for example, that we'll notice about the food is what it looks like. So we'll be observing the color and the shape of the food. Does that food look appealing? What about it looks appealing? Is it something that we'd want to eat? And we'll also be looking at the texture and size of the food. So the texture would be, is it soft, crunchy, smooth, thin, thick, rough, chewy, flaky? Is it too big or too small to put into a child's mouth? And then all these other components include the feeling of the food, so can the child touch it without any kind of aversion? And then eventually that child will be tasting that food. So what does it taste like? Is it bitter? Is it sweet? Is it savory? Is it salty? And all of these components factor into sensory-based feeding and food tolerance in young children. It is important to keep these in mind when noticing what your child does or does not like and how sensory and motor factors can be attributing to this. So a few things to keep in mind while you're feeding your child is you really never want to force feed your child. It will only make them more aversive to that sensory stimuli and can cause a lot more problems. You really want to allow your child to explore the food themselves and encourage eating through demonstration and positive reinforcement. I have seen parents, sticking spoons of food into children's mouths, and the child has almost a fight or flight response, which can make them a lot more aversive to that food because it seems like something dangerous is being shoved into their mouth without them willing to do it themselves. So that's why force feeding can be a really kind of dangerous thing. Additionally, everyone's oral systems are very different. So some approaches that may work with some children, others may not. Much of sensory feeding is trial and error and takes time to perfect. So you need to be patient with your child and even just celebrate those small achievements. Just putting the food in their mouth, that can be so huge for a child. So celebrating those all the time is very beneficial. Another thing to keep in mind is that we as adults know that vegetables are wonderful sources of vitamins, fiber, and antioxidants and have become accustomed to eating them, but green vegetables can be very bitter tasting, which causes an aversion to them right off the bat because, children act on a biological instinct rather than cognition. This is because their brains are really just still processing and learning what is safe and what is not safe to eat, and they can be hypersensitive to those bitter tastes until they learn that the vegetables are safe. I mean, when you were a kid, you probably didn't eat broccoli and kale and all these other things right off the bat. You probably had to take you a little bit of time to start enjoying that food. And studies suggest that it actually takes 10 plus times of trying a new food that you don't really like to develop a tolerance to it. So let's be patient with our kids who are not enjoying vegetables right off the bat. There's definitely a biological reason why they are not. That being said, if your child really does need to start eating more vegetables, pairing those aversive foods with dressings or dips, hummus works great, peanut butter, or even cooking those things with other appealing foods can really help increase that food tolerance. So for example, you could put bacon on Brussels sprouts. Bacon is a very appealing food for a lot of kids, and it could make them a lot more prone to eating them because it's paired with a preferred food. So now I'm going to share this really awesome visual with you guys. This visual was created by Kay Toomey, who is the founder of Sequential Oral Sensory Approach to Feeding. It's also called the SOS approach if you have heard of that before. And this is with the STAR Institute. As you can see here, it is important for your picky eater to be able to tolerate the food within a room even before trying to interact with utensils with it. So having that child help with food preparation is an excellent way to help the child tolerate foods and learn to feel comfortable around foods they may perceive as dangerous. Encouraging the child to smell the food helps the child make connections to what the food might taste like, as smell and taste are closely connected. And before tasting the food, however, it is important for the child to be able to tolerate touching the food and allowing it to feel safe on other parts of the body before they put it in their mouth to taste it. So just interacting and touching with that food can be a really great way to progress to that child putting the food in their mouth. Once they have done this and tasted it, chewing and swallowing is the final step to encouraging a child to eat new foods. And this visual is an excellent tool for parents to use to trial all the steps to eating to increase food tolerance during that mealtime. And in the next couple of clips here, you're going to see me actually implementing some of these SOS strategies. So for this first portion of these clips, what I'm doing here is I'm simply just going to be tolerating the food in my presence. So I'm looking at it, I'm letting it be present there. Great. Now what I'm going to do is I'm going to move up that hierarchy and I'm going to start interacting with it with utensils. So I don't have to touch the food other than with the utensils. I'm not actually, having to put it anywhere near my body. I am just simply using utensils to touch and interact with the food. You can also use something like a tongs to pick things up. This is a great way for kids to interact. You can make it into a game. Just having them grab those pieces of food and putting them into a bowl or onto something else can be a really fun way for them to start accepting food. Now what I'm going to do is I'm simply going to smell the food. So I'm going to go down, I'm going to put my nose close to the food and see how it smells. I'm not even touching the food yet. I'm using those utensils still to bring it up to my mouth. I'm wafting some of the food smell into my nose so that I can really get a good sense of what that food smells like. Now what you're going to see is I'm going to actually touch the food. So we're going to move up in that pyramid there. Maybe I just start poking the food first before I actually put my whole hand onto it. Maybe I'm like, I'm not really sure how this feels, but okay, now I'm going to try to grasp it, or I'm going to try to place my whole hand on it to start tolerating the food. Okay, this doesn't feel too bad. Now what I can do is I can touch it, hold it in my hand, feel what that feels like, and I can touch it on other parts of my body as well. This might seem kind of silly to be putting food on other parts of your body, but you can use really fun ways to interact with a kid to get them to move that food up their body all the way around until it touches their mouth. You can pretend that it's like a car and they're driving up the runway and getting it up into the parking spot where their mouth is. Now what I'm doing is I'm actually tasting the food. First I just kind of put it up to my mouth, and then I kind of put my tongue on it, then I actually take a bite of it. I don't have to swallow the food all the way yet, but it's good for me to interact with it that way. Now what I'm doing is I actually am tolerating the food enough where I can chew it completely and swallow it. And that will be the whole progression of your SOS pyramid. Another thing that you can do, for example, if you're really having a hard time getting your child to put that food in their mouth or chew it and swallow it all the way, is using dips. So what I have here is some guacamole and some hummus, and these are both really great things that you can use, or even like ranch dressing is great. So the kid might not like it at first, but okay, they're touching it, can put it up to their mouth, but don't quite like that taste. So they're going to use some dip like guacamole, and okay. Now this is kind of masking the taste of that vegetable. Cool, I'm alright with this. I can eat my vegetables with these yummy tasting dips and not feel like I'm being forced to eat anything. Another thing you can do is you can just cut the little pieces of food up so that they're a little bit easier to eat, or so they're just different shapes that the kid can interact with. So like here I'm cutting a cucumber into really small little pieces. Sometimes, the texture of a tomato can be really nasty if you put it in your mouth and you get that squishy feeling. So what you could do is even squish the insides out of there and cut it up so that the kid is more tolerable to that texture. Or you can just give a little small piece of that tomato, and the kid won't have quite as much of that squishy texture that's going to be coming out in their mouth when they chew it, so that they are starting to get more tolerance to tomatoes. You can also dip these in some dip as well to increase that tolerance even more. You could put it in like a little salad, or you can do something really fun and put the food into a fun little shape like a smiley face, so the kid is interacting more with that food and able to kind of have fun with it and play with it and know that this is really fun, this is safe for me to eat. And don't be afraid to let your kid get messy with this. Messiness is one of the best ways for kids to learn and really interact with those textures, and it's going to really improve their food tolerance a lot more. So let them smear that around. Let them get their mouths and their hands and their clothes all dirty, because in the end, if it increases the amount of food that they're going to eat, it's going to be very, very worth it. I hope that the content in this video was helpful and that it sparked some insight for how you can help your child at home with their. And just to clarify, I am not SOS feeding certified. I will be getting that as soon as I am able to once I am a licensed therapist. All of the content of this video is simply based on the principles behind SOS-based feeding therapy that I have learned from other therapists and have done some research on myself. So make sure that you check out the SOS Feeding site if you have more specific questions, and the STAR Institute, as always, is an incredible resource for you all to check out. Thank you for watching. Go ahead and like and subscribe.